And of course, I'm delighted that we're launching our renewed strategy here at the Bridge, which has been on the case promoting women's health and well-being for nearly 100 years, which I think is both inspiring and depressing in equal measure when you think about it, because it beggars belief, quite frankly, that your vision is for women's voices to be heard and that their health and well-being rights are respected and met. How on earth have we not got there yet in this decade of the 21st century? And that's what our women's health strategy sets out to do in the NHS. So I hope that you see today as a big stride forward along the road to your goal and the goal that we all share. Because there is absolutely no question, and I'd be the first to admit it, that the NHS has a problem with basic, everyday sexism and an appalling culture of medical misogyny. Almost every week I've spent in this job, I have heard profoundly shocking stories from victims and families of some of the worst NHS scandals. Women like those in Nottingham, Leeds and Sussex, who I'll be meeting again in Brighton this afternoon, whose babies have died in our care when they could have lived, and who suffered horrific injuries that went unacknowledged and uncared for. Women who've been treated appallingly by medical professionals and left in agony, disfigured and traumatised by botched surgery and negligent care. And women like Vicky Pattison, who I was with this morning, forced to undergo private care to get her PMDD diagnosed after 5 years, and being made to feel, as she put it very powerfully on Good Morning Britain this morning, like she was hysterical. Every story I hear is unique, each told with heartbreaking clarity and each with a common theme, that at the moment of greatest vulnerability, women were let down by the very people they put their care in. Being ignored, humiliated and disrespected are all too common experiences for far too many women using the NHS. More than 8 in 10 of you say there have been times when healthcare professionals didn't listen to you. I've seen examples of it in my own family, and I'm pretty sure you will have examples in yours, if not your own personal experience. One of my own relatives actually had an absolute nightmare with her GP on every front. Everything that could go wrong for her went wrong for her, and over a long period of time. And it wasn't until she took her boyfriend along to see her male GP on the 3rd occasion of asking for support with pain that she was taken seriously about the pain that she was in. And that simple failure to listen to women, to respect women, is how we end up with tragic cases like Jessica Brady, who died from cancer after her condition was missed or dismissed, despite more than 20 appointments at her GP practice. We introduced Jess's rule in her memory so that GP teams now have to reflect, review and rethink if a patient presents 3 times with the same or escalating symptoms, something that will benefit all of us, but I think will disproportionately benefit women.